Hi, my name is Abdul Khan, and I'm presenting a case report of a focal infarction of falciform ligament. We have a case report here of a 65-year-old female who had had a history of hepatic adenoma and came to the ED with right upper quadrant pain and underwent a CT scan to sort of look for etiology. Interestingly, on the CT scan, the liver looked pretty normal. The hepatic adenoma is not really well seen on the CT, and the gallbladder looked normal. Other sort of various abdominal structures looked normal, but we noticed that there was some inflammatory changes and swirling around the umbilical vein and fat stranding about the falciform ligament. And so looked at this and did a quick literature research and found that this is likely representing a focal infarction of the falciform ligament. And so this was reported to emergency department, and she was sort of managed conservatively and discharged. Now, because she had had a history of a hepatic adenoma, she actually ended up following up with her PCP and obtained MRIs to sort of evaluate that adenoma approximately 10 days after her presentation to the emergency room. And interestingly, we could follow our diagnosis with the MR. Here we can see T2 sequences demonstrating sort of encapsulation around that area of fat necrosis about the falciform ligament. On this pre-T1 sequence, we can see sort of inflammation and edema in that area as we had seen on the prior CT. This is a post-contrast image, but T1 sequence. Here we can sort of still see that sort of swirling around the umbilical vein and inflammatory changes here as well. So sort of like an ongoing inflammatory process. Here we can also see sort of the uh, encapsulation of that area of necrosis because there's this sort of rim enhancing area and sort of involution of the fat there. And so this sort of corresponded well with our initial findings of focal infarction of the falciform ligament and sort of the sequelae or natural history of this process. The patient uh, reported a sort of resolution of their symptoms on follow-up visits with the provider. And so it was interesting to note that this is something that should be in the differential for right upper quadrant pain and something that radiologists should recognize when they see it.